It works.
Waking up now.
The phone waking up. Don't answer, you don't know.
They know who you are.
Why are you stopping us? Stupid. So stupid. They hate you.
Why are you going to pick up the phone? Stupid. Stupid.
They'll know. God, please.
Something wrong.
They'll know.
Package. Poison package.
Henry, never open poison.
Coming for you.
Stop.
Schizophrenia. Schizophrenia is a psychiatric syndrome characterized by psychotic symptoms of hallucination, dissolutions, and disorganized speech, by negative symptoms such as decreased motivation and diminished expressiveness, and by cognitive deficiencies involving impaired executive functions, memory, and speed of mental processing. History of schizophrenia. The timeline depicts an evolution of the concept of schizophrenia throughout the years. For centuries, psychological illnesses such as schizophrenia have been viewed from a supernatural perspective. Dating back to the 19th century, Emil Kraepelin interrogated several entities under the umbrella of dementia praecox, later termed schizophrenia by Bleuler. In 1911, Eugene Bleuler believed that the essence of schizophrenia was not delusions and hallucinations, which he regarded as accessory symptoms, but the disintegration of different psychic functions leading to its fundamental symptoms of loosening of association, blunt or incongruent affect, ambivalence, and autism, which are now considered negative symptoms, which were present in all cases. In 1959, Kurt Schneider defined 11 first-rank symptoms that are now considered positive symptoms. Today, schizophrenia could possibly be a separate disorder that could be clumped into a mixed category of psychosis or split into the meaningful and biological validated subtypes. Behavior observations and symptoms. As noted, schizophrenia has positive and negative symptoms. Positive symptoms include hallucinations, dissolutions, thought disorders, disorganized speech. Negative symptoms include reduced feeling of pleasure, lack of facial expression, apathy, poor attention and concentration, lack of motivation, and socially impaired. Treatment history outcome. According to Martyr, before treatment can begin, any potential psychotic state that could mimic the disorder needs to be ruled out. Confirmation of the disorder criteria needs to be met. Potential patients go through a physical exam and a basic laboratory evaluation. If a patient is not cooperating, they can be medicated immediately. History of schizophrenia. In Schizophrenia, Just the Facts, Clinical Features and Conceptualization, schizophrenia is characterized by a sequential trajectory that involves a pre-morbid phase with subtle and non-specific cognitive, motor, and/or social dysfunctions during childhood. Next, a prodromal phase during adolescence characterized by attenuative positive symptoms or basic symptoms and declining function. Then, the first psychotic episode happening in young adults, hurtling formal onsets of schizophrenia, the initial decade of illness generally marked by repeated episodes of psychosis with with partial and variable degree and duration of inter-episode remission with accrual and disability with each episode of illness. Decline in function is most pronounced in the first 5 years after a few episodes of psychosis, at which time patients may bottom out in terms of deterioration. Finally, a stable phase or plateau when psychotic symptoms are less prominent and negative symptoms and the stable cognitive deficiency increasingly predominant. Recovery of varying degrees can occur at any stage of the illness, and in contrast to the original Kraepelian perspective of unalterably, unalterably progressive deterioration, a significant proportion of individuals with schizophrenia exhibit substantial improvement. Medical and psychosocial treatment. Medical treatment. Most medications are taken orally, and clozapine happens to be the most effective in patients that are living in the community as well as patients that have been institutionalized. 1% of patients beginning to take clozapine potentially develop fatal granulocytosis. Psychosocial treatment. Cognitive behavioral therapy helps most patients with preserved insight that have better motivation in exploring the lack of their reality relating to symptoms. For example, if a patient has the belief that people who are looking at him in a cafe are foreign government agents, the therapist may help the patient to consider alternative explanations for the glances of the cafe patrons. Defense mechanisms. One research study that supports predictions the preference for positive interpretation and growth as a coping style was negatively correlated with depression and poor self-esteem. The findings suggest that adopting a positive reinterpretation style of coping rather than a denial style of coping is a significant factor involved in reducing distress. It must be noted that the 65 patients participating in this study were all on stable antipsychotic medication 3 months prior to the study taking place. Functional assessment. Recently, the PSP scale, which is based on the social and occupational dysfunction criteria included in the DSM-5, has been developed specifically for the assessment of functioning in schizophrenia. The ratings are based mainly on the assessment of a patient's functioning in 4 main areas. 1. Socially useful activities including work and study. 2. Personal and social relationships. 3. Self-care. 4. Disturbing and aggressive behaviors. The domains of functioning assessed by the PSP scale capture the various phases of schizophrenia. These characteristics, along with its high phase validity amongst clinicians, indicate that the PSP scale may provide a useful tool for the assessment of social functioning in future schizophrenia research. Diagnosis of the psychopathology.
Positive symptoms include delusions, hallucinations, and thought disorder, among others. Negative symptoms include apathy, social withdrawal, restricted affect, and anhedonia. Cognitive deficits include disturbances of attention, memory, and executive function. Mood symptoms include dysphoria and depression, among others. Some authors
Treatment plan and likely prognosis. Although antipsychotic medications are the mainstay of treatment for schizophrenia, pharmacotherapy alone produces only limited improvement in negative symptoms, cognitive function, social functioning, and quality of life. Patients continue to suffer from positive symptoms and relapses that are mainly caused by failure to follow through with prescribed medication intake. Some patients may continue to suffer from psychotic episodes, and that is why CBT seeks to help patients rationally appraise their experience of disease, symptoms, and how they respond to them, thereby reducing symptoms and preventing relapse. Conclusion. Although there has been improvements in research regarding schizophrenia in the past years, with new technology and advancements, we can only hope for further knowledge. While working on this assignment, I realized the need for one or two, maybe three ways of psychotherapy along with psychopharmacology can help alleviate symptoms for patients.